Okay, we're going to get started. Good morning. Thank you all for joining us. We're going to be discussing today using DIRECT for behavioral health and then immunization reporting. You should see the call-in number and the access code both on the PowerPoint and on the audio tab on the right-hand side. Today's webinar should last about 30 minutes, after which we'll be taking any questions. I'll just give you guys a little bit of introduction how to use this GoToWebinar system so that you'll be able to ask questions as we go as well. On the right-hand side of your screen, you should be able to see a questions tab. You can ask questions there at any time. If there are technical questions, if you're having trouble connecting or anything like that, I will try to address them as we go along. If you have questions about the content of the presentation, we'll be taking all of the questions at the end. In addition to the questions that we'll take electronically, we'll also open up the audio at the end of the call so that you can ask any questions. We are recording today's session. We will make the PowerPoint and the recording available to all of our participants afterwards so that you can review it or share it with others. Today, our presenters are Michelle Darnell, the Vice President of Business Development for Secure Exchange Solutions, and Jeff Salmon, the Healthcare Solutions Architect for Secure Exchange Solutions. My name is Rebecca. I'm also from Secure Exchange Solutions. We're also pleased to have with us Ms. Kathleen Greenaway, the Direct Project Manager of the Health Information Technology Division of the Virgin Islands Department of Health, and Mr. Kevin Hodge, the Director of the Health Information Technology Division for the Virgin Islands Department of Health. Again, thank you all for joining me, and Michelle is going to kick off our presentation now.
Thanks, Rebecca, and thanks to all of you for joining us today. This is our fourth webinar in a series that we put together in conjunction with the Virgin Islands Department of Health and to educate participants around the uses of direct health information exchange. So to refresh your memory, DIRECT is a nationally recognized standard for secure information exchange, and the Virgin Islands program will launch in Q4 of 2012. I'm with Secure Exchange Solutions, and we are the certified health information service provider that is providing the underlying technology for the Virgin Islands DIRECT program. Topics that we'll cover today are as follows. We're going to review for the new participants some basics around DIRECT quickly, and then dive into how DIRECT can be used in a behavioral health setting. And then we'll spend a few minutes around DIRECT and immunization reporting, and then refresh everyone's that's participated before memory on how you get started. And this hopefully will be useful information for new attendees as well. And then lastly, as Rebecca mentioned, we'll open the floor up for questions. A quick refresher on DIRECT. DIRECT is an encrypted mail standard that protects sensitive health information that's sent between providers. It complies with HIPAA. The ONC defines DIRECT as a set of standards, policies, and services that enable simple, secure transport of health information between authorized care providers. DIRECT will be the baseline for health information exchange between trusted entities within the Virgin Islands healthcare provider network. So most importantly, DIRECT is secure and it's internet-based. It's simple. It's easy to connect stakeholders through a standard universal addressing mechanism and a simple push of information. It's secure. Messages can easily be verified that they're complete and they're not tampered with during transport. It uses SMTP MIME at the organizational level. The message encrypts it, protects it, and digitally signs the message. It's scalable, can be used by the smallest office, and also integrated into larger organizations and their current systems and workflows. And as we mentioned before, it's standards-based, which is critical for making it universally available for everyone. Some other basics about the Direct project and kind of common threads. Any healthcare participant that has a need to push information can take advantage of Direct. So this could be an eligible physician, it could be a nurse, a clinician, a care worker, social worker, caseworker. They simply need to be verified by the entity that is running the program, and then they'll receive a direct email address and a digital certificate. Other common thread with Direct is there's actually identity assurance and encryption from sender to receiver. It's available through a variety of mechanisms. So there's not only one approach to get access to a network. Participants can get access to direct messages through a variety of mechanisms. It might be through a web portal. It could be through their current EHR system. It could be through a client or an email client plugin. And through the ONC Direct project, they make available through their reference library code that actually helps you get started as well if you wanted to integrate Direct into your existing systems. So what is needed to implement Direct in your organization? You need to create an account with what is called a Health Information Service Provider, a HISP. SES is the HISP for the Virgin Islands HIE project. This HISP will actually establish a secure email address for your organization or for participants that are part of your organization. So this could be, primary care group at directaddress.net. It could be Dr. Smith at directaddress.net. It might be a hospital group which actually uses a concierge direct domain as well. And as I mentioned before, you need some mechanism to get access to direct messages. So that could be as simple as a browser and access direct messages through a web portal or through a client or your EHR. And then once your organization has received a direct address, it's also possible to get, you would want to get direct addresses for all other healthcare participants that you hope to exchange information with. And so other healthcare participants they don't have to be using the same direct address provider as long as it is a standard direct email address. You should be able to communicate with them. So participants can be a variety of types and organizations, and you can get a direct address in a couple of different ways. The SES directory has a mechanism to obtain a direct address through our directory, which also searches the domain name service to look for addresses, or you could also get it through an out-of-band mechanism, for example, just calling someone, asking them, or they might publish their direct address on their website or on their business card. So we're going to move along and talk about a few use cases in the behavioral health setting that might be of importance to you, some benefits of using Direct in this setting, and then some of the frequently asked questions that we hear. A few of the there are many use cases. A few that rise to the top in terms of importance are that Direct really can help providers exchange information such as consent forms, continuity of care documents, referrals, summary care records that will lead to more efficient, complete coordination of care. One of the most important use cases revolves around emergency care. So a patient might be admitted to the hospital. Their primary care coordinator or their care manager is unaware that the patient received hospital care, and so Direct is a perfect use case for transmitting alerts, discharge notices, and instructions to the primary care provider after the patient has been admitted or discharged from the hospital. So in the immediate notification, could happen to their email account. It could happen to, they could get this on their mobile device using a direct message at the request of, and the consent, of course, of the patient, and at the request of the provider that's managing the care. So these notifications could be in response to anything, to registration to the ER, observation, admission to some type of, to the inpatient facility. And the notification could be as simple as an alert, or it could also have structured information that goes along with it relating to discharge notices and instructions. Another area that is seems to be very important in the behavioral health setting is the referral of the patient from various facility to facility. So that might be from an FQHC to primary care provider. It might be over to a particular social worker. And direct is a perfect mechanism to support a referral. The other area that we see is of importance is around responses to requests for medical records. And so these requests could come from a number of entities. It might be, from a hospital. It could be from a primary care provider. And then lastly, direct could be used to send patient consent forms at a faster pace and electronically. So there are probably more use cases than what I've just described. I mean, we could certainly talk about, handing the patient back to the primary care provider, notifications around their visits. There are many others that we could talk about. We're going to focus on these today. So in the case of the patient discharge, what generally happens today is the information flow is not timely, and therefore it doesn't really help with the care coordination. So the patient might be discharged, and generally some paper discharge instructions are made available. And so these discharge instructions come via fax or regular mail to the clinic or to the provider that is managing the patient. If the clinic or the practice has electronic health record, this information is usually scanned, and then it might be attached to the health record. But and that's wonderful for tracking the information after the fact, but in many cases that doesn't happen in a timely enough fashion to benefit the patient visit. So when the provider is not aware when the patient visits about the recent activity, and so critical information that might have resulted from the discharge, it could have something to do with the medication list, is not available for the patient visit. So it's just not timely, and it doesn't help with care coordination. Direct can make changes that are beneficial to that flow that would lead to a faster flow of information. So, that scenario which you'll see today is, more of a real-time exchange of this information where the hospital perhaps could provide an alert indicating that the patient had been admitted. So the clinic or the provider would have some understanding that the admission had occurred, and then also get follow-up information about the discharge. So instead of a nurse walking the discharge papers over, or the patient bringing the discharge papers, the discharge notes in summary could be transmitted electronically to multiple activities at the same time. So that's just as simple as the message being pushed using direct in a secure and private manner to either the clinic or the primary care provider, who would access this in a variety of ways. Could be webmail, could be through their current EHR. The other setting is, and we've talked about this on some of our earlier webinars, is the referral. So the patient might present at the primary care or at a practice, and they had been notified of the patient discharge. They evaluate the patient, they refer it, and the referral summary is sent to the specialist using direct. It could also be used to transmit medication history and any other notes about the consult that are important to the patient's visit. One of the other use cases is just in general medical records requests. And in terms of the flow that you see on the screen, this is from the hospital, the hospital which typically faxes a medical records request to the provider. They could instead email that medical records request to the provider using direct. Or even if the provider receives the request via fax, they could transmit, if the hospital has a direct address, they could transmit the medical records back to the hospital securely, privately, using direct. And so this would typically transmit the information to the medical records group within the hospital. The information that can then be attached to the hospital's EHR. The information could come in any chosen manner. It could be an CCD, structured form, or it could be an image or a PDF if it's just notes or summaries that are coming from perhaps an office that is not yet equipped with an EHR. So what are some of the benefits of using direct in the behavioral health setting? First of all, the information is secure, and the information happens, the transmittal can happen at the point of service. And it's when we talk about secure, it's actually what we hear often is that most of this information today is being transmitted using fax. And so even if you call and ask someone to be at the fax as the information comes through, there's still some risk that that doesn't happen. So this is actually a very secure alternative to fax or to certainly to normal email and to mail as well. So there are some absolutely wonderful benefits around using direct in the behavioral health setting when it comes to securing information. HIPAA compliant. Hopefully this will lead to better coordination of care and improved outcomes. And it saves offices and groups time and money as well, just in terms of the administrative costs of dealing with paper and scanning and personnel to manage paper and scanning. So what are some of the frequently asked questions that we hear about direct just in general? What's happening in many other areas is there are a number of really great projects. Some are still in the demonstration mode. Some have moved beyond demonstration around integrating behavioral health and integrating HIE as a part of that. So the challenges that we generally hear about in this area really are all about protecting the consumer confidentiality while still facilitating, a faster and better exchange of data. And what we see in some areas is that some states have a higher confidentiality threshold for behavioral health than in other states, and direct can help address the need for increased coordination, for protecting confidentiality, and ultimately improving this quality of care, for clients. And as I mentioned, there are a number, and if you have interest, we can point you to a number of the states that are sort of ahead of the game in terms of establishing some best practices in this area in behavioral health and using direct. So what are there secure means? Of course, this is what we're talking about with direct, because since direct messaging enables licensed providers a way to send it in compliance with HIPAA, all you really need is an internet connection. Obviously, you have to have a direct address which is attached with a public key and a private key. But if you have that, a web browser, you can exchange information of both, with behavioral health and medical services, and that will help to demonstrate the integration of these areas to improve quality of care. Often we hear, if we already have an EHR, what do we need direct? We've covered this on some of our earlier webinars, but chances are with your current EHR, you still need to be able to communicate outside of your practice or your health system, your organization. So most practices that are using EHR today are still sending information by fax because their system can't communicate securely across these varied networks. So now I'm going to transition over just to immunization reporting. Similar to behavioral health, immunization reporting, there are a number, most areas already have immunization reporting activities underway, and it's our understanding that in the Virgin Islands that you have electronic immunization reporting projects underway. And what's being used across a number of different states is using direct really to simplify and streamline the secure communications to some of the immunization reporting systems. So it can augment the existing systems, or in some cases where those systems are not yet fully available, it can secure the communications to the public health entity. So direct can enable two-way communication, and which will help with, of course, meaningful use, and ultimately to increase safety and quality of care. One area that's not often talked about is that provider offices could also use direct to respond to patient requests for immunization records. So that's different than the public health reporting, but we thought we would put that in there because we hear that as an area of interest, specifically in practices in a practice setting. So in terms of a use case around this, as you would imagine, if the office is using electronic health record, then the electronic health record system is able to generate the file that needs to be transported for submission, and you use direct to encrypt the package and transmit it to the public health agency. And then the record gets added, of course, to the reporting system. So the approaches that we're seeing in a number of the projects is that either a flat file in the structured approach is going to the public health department using a direct wrapping, or the HL7 message can be embedded in a standard direct format as well. So with that, I'm going to turn this over to Jeff Salmon, who will take some of these use cases we just described and turn those into something that you can see live and in person. I did want to point out that one of the beautiful things about direct is that it can be used for any facility. So, we've talked a lot so far about, some sites with electronic health records, but I did just want to remind everyone that direct is, it's great at bridging the gap. It's a fantastic starting point for secure health information exchange. If facilities have an EHR, that's great because they can use direct to transport CCDs or immunization reports that might be generated from their system. If they don't have an EHR and they're just fax or paper-based today, direct gets them one step further with a secure, fast, efficient manner for transmitting information. If you've got facilities that have two different EHRs, so maybe you've got a hospital that's running Meditech and a specialist group that's running NextGen, then direct can be used to transmit information between those two facilities, which are running different EHRs. So it's just fantastic for leveraging the current workflow. So with that, I'm going to turn it over to Jeff Salmon, who will spend a few minutes and show you a couple of the use cases we've just spoken about.
Thanks, Michelle. What we're going to do now is we're going to log in to the directaddress.net account. This will be slightly different for people in the United States Virgin Islands. It'll have a slightly different look and feel, and the URL will be different. And and the first thing that you see is the email account that that comes up. So what we've done is we've received a couple of notices from other physicians or hospitals. In one case, we've received a patient discharge notice. So the discharge notice is an attachment to the document, and I can simply show the actual human-readable document that you see here. I can respond to this document, but typically it's simply a notice from the hospital that that comes out. Probably of something of more important would be an admit notice, especially in the behavioral health field when it's not always clear when a patient is going to come into the emergency room. In this case, you see a message from Johns Hopkins Hospital and Medical Campus. Maria Jackson sent the email address, but it could be sent from anybody or a generic Johns Hopkins address. Notices that it's got your patient ID number, and the patient name. It's got the facility address associated with it, and again, there's an attachment to show you more details associated with that notice. Other things that can be done using the system include immunization records. Now, those are typically going to be sent in an HL7 format, as you see here, and they're in the future can be an automated method of doing that. At this point, we do can use Direct to receive email messages and send email messages to the state reporting agency for immunization reporting as well. So it's simply a matter of taking the data out of your EHR system. Generally, that'll generate an HL7 message, and you can then attach that HL7 message to an email and send that directly to the state reporting agency. As you can see, there's some other referral notices associated with it. On a referral notice, a lot of times you're going to want to send not only a human-readable PDF file that you see here, but you can also incorporate the continuity of care document as well, so that the physician that receives this information can take that CCD file and import it directly into the application, their own EHR system, so that they don't need to either manually data enter data or request information from the patient when he comes in and spend several minutes basically recreating the same information that you had when you referred that patient to them. Michelle, did you want to show the documents going into an EHR?
I think just a referral. I think that's probably good, Jeff.
Okay, great. And so there we go. I'm going to pass it back over to Michelle, and we can move forward on how to get started.
Great. I think, Rebecca, do we have any questions so far?
Not yet, Michelle. I think you can go ahead and finish up. Michelle?
Yes, I'm here. So, if there are no questions, we can, I just wanted to kind of recap what we've spoken about so far. You can use Direct to support referrals, transitions of care. On the immunization reporting front, it can be as simple as converting a current fax process to a secure email process, or as sophisticated as transmittal of the information using an HL7, as Jeff just described. Our next session, our next webinar session, will dig in more detail into how do you really, what are all the steps to get started to register, to enroll online, and to get both your organization and your physicians registered and enrolled online. And we'll be covering that in our next web session. So just to recap what we learned, Direct is secure, and useful for both of these settings, and it's going to be available very soon through the Virgin Islands Department of Health, and we look forward hopefully to seeing all of you again on September 11th, which is our next web session for that will cover enrolling and registering in Direct.
Okay, we do now have a couple of questions that have come in the meantime since you last asked. I'm going to open up the audio now, and we'll start with Dr. Christian, who had a couple of questions for us. Just going to give me one moment to open up everybody's audio lines. Okay, Dr. Christian, we should be able to hear you now.
Can you hear me now?
Yes.
Okay. The first one is, I think they have covered in the previous one, so this is a recap, but just how many licenses will be available in the free period in the year? You want me to give all the questions I have? 4. You want me to do them all together?
Dr. Christian, I'm having a bit of a hard time hearing you.
Can you hear me better now? Can you hear me better now?
Much better.
Yeah.
If you wouldn't mind asking again, I'd appreciate it.
Yeah, I have 4 questions. Should I ask them all at one time? I'll do that.
Why don't you ask them one at a time, and
Okay.
then we'll just answer them one at a time.
Okay, the first one is how many licenses, they had said this in a previous one, how many licenses will be available in a free period, or how many emails, addresses could be handled in the free period? The first year I understood that the Department of Health was going to allow the different email addresses to have this at no cost. So I was wondering, is there a limit on how many people can sign up?
This is Michelle Darnell. I'm going to answer that for Kathleen, and she can correct me if I answer it incorrectly. So I think there are 100 that are available in the pilot period, and when we say 100, that could be set up as you can set up an address as an organization, for example. I use example in the webinar about primary care clinic, or it could be hospital A, or it could be medical records department or billing department. Or it could be as granular as Dr. Smith. So Kathleen may want to add to that, but I think that's the overall answer in terms of how many available.
Okay, because from our perspective, it may be important to prioritize the institutions and some of the providers that have high volume, but that was the first question. The second question is, when you send out an email, can it be to multiple addresses like a regular email? And also, the third question relates to how it's processed, so I might as well ask it together. In Outlook, you can get options where it tells you when it's delivered and it tells you when it's opened, because we might be wanting to look at timeliness. When we, for example, we do things with notifications with the hospital from the Medical Institute, and so this would be a wonderful mechanism if we could also identify timeliness as to when it was delivered and when it was actually open. So if they could answer those two, multiple addresses and timeliness, and then I have a last question after that.
Well, those are great questions. So on the multiple address front, absolutely. So let's say, for example, there are 3 different parties that are involved in some transition of care. You can send to multiple secure addresses. So that's the key word, multiple direct addresses. They don't have to all be associated with the SES direct HIS, but they would need to have, it would need to be an official, direct or secure email address. There is a feature that we have available that will notify your general email message when a secure message is received in the inbox. So I think you can achieve what you're hoping to do in 2 ways there. You could send to multiple secure addresses and then notify your normal email or the normal, practice or hospital email when a secure message has arrived. And then on the timeliness question, I love that question. And one thing, because we were just conscious of the time that we didn't cover on the demo, is you can see exactly, you get something, it's referred to as a message delivery notification that actually comes back in a secure fashion, and you see that on the screen in terms of delivery of the message. And I think you could track against that and certainly see that as part of the exchange. So you can tie the message delivery notification actually to, if you needed to wrap around that to, issue some kind of alert that would, of course, maybe take some customization around it, but that would be an option as well to say, oh, your message was either not, did not get received, or your message was received on this date, and therefore, you haven't taken any action on it. So I think there are a lot of interesting options around that particular question.
Okay, and then my last question, I'm just going to give my last question, but just I want to point out that I may not be available to listen on September 11th because it's my birthday, and I usually take that day off, but I might make an exception because this is so important.
Happy birthday in advance.
But the question is, just like we have promoted having e-prescription as a law where all providers have to e-prescribe except for narcotics, I'm just wondering, and maybe we're ahead of ourselves, but I'm just wondering if the Department of Health is looking at encouraging all of us at least to do reportable events through this mechanism so that we can get great penetration quickly. The fastest way we got people to start e-prescribing was because we promulgated that law, and although it isn't 100%, everybody isn't doing it as they should because they're not penalties, it just pushes us along to really have this communication activity going on very rapidly if the Department of Health puts out some type of rule or regulation that says, do it this way. And, and so I'm just saying this as a possibility for the staff at VIDOH to just think about having that, at least if not in the very beginning of the pilot, soon thereafter, so that we can have great penetration, because I think it's so useful.
Yeah, I think that question is probably for Kathleen. I'm not sure if she can answer. I see her phone is still being muted.
Yeah,
Kathleen?
we don't have Kathleen on audio this time, but I'm sure she definitely can hear you, Dr. Christian, so I think we'll be able to take that one offline. And if we have any other questions, we'd be happy to take them now, either electronically or over audio. As Michelle said, our next webinar is on September 11th. At the same time, it will again be about a half-an-hour presentation. We'll open it up for questions, and it'll be about how exactly to get started and sign up and get going with direct in your practices. Okay, I see that there's a question from, just a moment, I'm sorry, from Schneider Regional Medical Center. Angela, if you could type the question, I would appreciate it, because I don't seem to have you on audio, or you can put in your audio pin and then I'll be able to hear you. We'll wait just a second for that question to come in so that we can address it. Okay, we'll give it one more moment, and then if it doesn't come through, then you're welcome to email me afterwards, and we will certainly address it. Okay, the Schneider Regional Medical Center said that funding is an issue. How can we get help with funding that will be needed to pay for the system? I suspect that's also a question for Kathleen. I suspect that's also probably a question for Kathleen, who's having trouble with her audio at the moment. Michelle, unless you might be able to take a stab at addressing it, maybe we'll connect the two of you afterwards.
Yeah, I think actually that would be a great idea. I did want to, I think that using direct in general for HIE is a nice, I know there are a number of programs around, in particular, behavioral health that could be, improved in terms of the submission, for example, for a grant with the use of a secure, health information exchange. So I don't know if you've checked into those, but I would probably defer that question to Kathleen, especially as it pertains to getting on board with this project. But you might explore other grant opportunities that could utilize DIRECT for improving transitions of care and coordination of care.
And Kathleen did type in electronically, this is a response to Dr. Christian's last question, that using the exchange for reportable events is definitely going to be an expectation in the U.S. Virgin Islands with this program. And the Schneider Medical Center questions I will pass on to Kathleen via email so that she'll be able to respond to them thoroughly. If we don't have any other questions, and it looks like we don't, I think that we will start to wrap it up soon. Kathleen also added that they expect to offer software for e-prescribing within the first quarter of the project. They hope to offer software for e-prescribing within the first quarter of the project. Okay, so thank everybody for joining us. It was a great session. If you have any more questions, you're welcome to email them to me, and I will connect them to all the appropriate people to answer them. My email is rlhasid@securexsolutions.com. My email also appears on this presentation, so we'll send it out to all of you in a couple of hours, and you'll be able to see my email address, and I will be happy to answer any additional questions. We look forward to having all of you with us at our next webinar on September 11th. Thank you for a great session, and have a great day.